and welcome everyone to our webinar today. We are pleased to partner with the National Association of Welfare Research Statistics, Public Consulting Group, and the Administration for Children and Families on this two-part series on the Family First Prevention Services Act from introduction to implementation. APHSA and PCG are sponsoring this webinar as part of the NARS Virtual Learning Series. My name is Meg Dygert, Policy Associate for Child and Welfare and Family Wellbeing Portfolio here at APHSA. First, I'm going to start us off with a brief overview of APHSA and then turn it over to our speakers to start today's presentation. APHSA is a bipartisan, nonprofit membership organization. We represent state and local health and human services agencies through their top-level leadership, as well as various programmatic staff, such as child welfare directors, CIOs, SNAP and TANF, and child care directors, through our affinity groups, like the National Association of Public Child Welfare Directors. APHSA also advances the well-being of all people by influencing modern approaches to sound policy, by building the capacity of public agencies to enable healthy families and communities, and by connecting leaders to accelerate learning and generate practical solutions together. Now I'm going to hand it off to Lauren Anatello to start today's presentation. Thank you.
Thank you, Meg. I'm so excited to be joined by everyone this afternoon. I'm going to first start by introducing you to the great group of speakers that we have for the first part of this series. I'm the Associate Director for Strategic Initiatives at the Administration for Children and Families in the Office of Regional Operations and the co-chair of the NARS, National Association for Welfare Research and Statistics, Virtual Planning Committee. So in this first part of the series, we will be joined by Dory Snedden, who is a child welfare specialist in the Office on Child Abuse and Neglect at the Children's Bureau at the Administration for Children and Families. In this role, she leads the work on the FFPSA Title IVe prevention plans and manages a portfolio of discretionary grants, cooperative agreements, and contracts that have focused on child maltreatment prevention research, program evaluation, family homelessness, and partnerships between child welfare and other public serving programs. Prior to joining the Children's Bureau, Dory worked in both the public and private sector on issues related to child welfare, youth aging out of foster care, and family homelessness. We'll also hear from Christine Fortunato, who is a team leader for child welfare research at the Office of Planning, Research, and Evaluation, OPRE, in the Administration for Children and Families at HHS. Chris develops and coordinates research activities related to child welfare and early care and education programs serving low-income children and families. She oversees a diverse array of projects, including the National Survey of Child and Adolescent Wellbeing, Child Maltreatment Incident Data Linkages Project, the study of early Head Start child care partnerships, and the Title IVe Prevention Services Clearinghouse. She's particularly interested in using research and data to help key stakeholders make informed decisions about implementing feasible and effective programs and services. She originally began her work at OPRE as a Society for Research and Child Development Executive Branch Policy Fellow. And finally, we'll hear from Sandra Jo Wilson, who's a Principal Associate in the Social and Economic Policy Division at Apt Associates. Dr. Wilson's work focuses on approaches to developing and dissemination actionable evidence on effective programs. She's an expert in the design and conduct of meta-analyses and systematic reviews and has broad content knowledge relevant to youth prevention programs. She is the project director for the Prevention Services Clearinghouse, which we'll hear more about today. She also currently leads a project supported by the Assistant Secretary for Planning and Evaluation at HHS to develop practice guidelines for youth programs that uses a common components approach to evidence-based practice. Her domain expertise is also varied, including school-based violence prevention, juvenile delinquency, high school dropout prevention, college and career readiness, and early childhood education. We're really pleased to have these three speakers with us today. Before we jump in, I did want to give those on the call a brief introduction to NARS. We tend to hold in-person conferences every other year where human services researchers, practitioners, and policymakers come together to talk about their work and how it can inform policy and practice. Several years ago, NARS began holding virtual events in the years where the conference wasn't occurring, and it represents an opportunity for us in the NARS community to engage and highlight interesting research and trends relevant to the membership. I really want to extend my appreciation to several folks who made this panel possible, especially the American Public Human Services Association and Public Consulting Group, and in particular board members at NARS, Ann Flagg at EPHSA, and Tony Ong at PCG, as well as Meg Digert. Today's panel would also not have been possible without my fellow committee members, Ben Jacques Leslie of Minnesota and Kato Kawabata of Riverside County, California, as well as my co-chair on the virtual workshop committee, Asaf Glosser of MES Associates. They all were really instrumental in making this come together. So as we jump right in, we wanted to get a sense of who is in the audience today. So if you wouldn't mind, please let us know the type of organization that you represent. Great. We'll see at this, as the results are coming in, it seems that we've got pretty even split in terms of state and tribal government as well as nonprofit community-based organizations. Great, wonderful. And before I turn it over to Dory, I just want to remind folks that on Thursday we'll have a follow-up, the second part of this series, where we'll actually hear from your colleagues in both Arkansas and Ohio on their evaluation plans for Family First. So with that, let me turn it to Dory.
Great, thanks, Lauren. Good afternoon, everybody, or good morning, depending on where you're calling in from, where you're joining from. And thank you for inviting me to present today and for your interest in the Family First Prevention Services Act, for taking time out of your day to be a part of this. In my remarks, I'll refer to the Family First Prevention Services Act as FFSA. As Lauren said, I'm a child welfare specialist at the Children's Bureau, and in my office, the Children's Bureau oversees the implementation of FFSA. Specifically, I work on reviewing the Title IV Prevention Program 5-year plans from states. So for this presentation, I was asked to provide information about FFSA overall, as well as the Title IV Prevention Program 5-year plans. So I expect there's a range of familiarity with FFSA. So my presentation, which will be really brief, will be really high level, and we'll cover an overview of FFSA legislation, but then I'll include and the prevention program, and then I'll include resources at the end, and you see the presentation, you'll have a copy of that PDF, so I'm hoping you can go back to that if you have any interest in kind of looking into pieces of the presentation further or the legislation. Okay. So just a little bit about the Children's Bureau. The mission of the Children's Bureau, which sits in ACS at the U.S. Department of Health and Human Services, is to improve the overall health and well-being of children and families. We provide funding and support to strengthen families and prevent child abuse and neglect, primary prevention as well as secondary and tertiary prevention, permanency, and to protect children when abuse has occurred. So under the direction of our Associate Commissioner, Jerry Milner, the Children's Bureau has been aggressively promoting a new vision for child welfare in the U.S. That vision calls for reshaping the child welfare system to one that is focused on primary prevention to strengthen families and communities to reduce the likelihood of child maltreatment. We have two overarching goals. The first is to prevent the need for families to ever make contact with the child welfare system, and the second is improving the foster care experience for children and youth that need to be removed for both those children and their parents. I wanted to give you that overview because FFSA fills an important gap in the prevention continuum, allowing for some secondary and tertiary prevention efforts that are evidence-based to prevent children from entering foster care. It allows us and states to use the largest pool of federal child welfare funds for services to help families stay together when children are at imminent risk of entering foster care. As such, we see FPSA as a tool in the prevention continuum. It presents an opportunity for states to reshape child welfare practice in many ways. It also provides opportunities for building evidence related to prevention services for families and children and child welfare. So specific to just the overall legislation in the next 4 slides, and so this is very high level, I'll provide an overview of the FPSA legislation and the major provisions. So FPSA is a complex piece of legislation with many provisions, and I wanted to share this with you today to provide a framework of the legislation. But like I said, if you have specific questions, you can, I would offer the first place to look is our one of our program instructions that I have linked, that I'll have linked at the end of my slides, which is 1806 is the number at the end, but I'll point that out. But FPSA overall reauthorized promoting safe and stable families. It revised the definition of family support services to include supporting foster families, support quality family-based settings for children in foster care, and it removes the 15-month limitation for children, for a child in foster care to receive reunification services. FPSA also amended the CHAFE program, which is one that's close to my heart, for youth transitioning out of foster care. It revised ages to extend education and training vouchers available to youth ages 14 to 26 and extended foster care up to age 23, which was previously age 21. This is the slide that I was just speaking to, the changes to CHAFE. So amendments to the Title IV foster care program. FPSA made the following changes, and I'm giving a line for each of these, but just note this is very complex. So related to family, the changes are related to family foster home size. They placed payment limitations for child care institutions and revised background check requirements. And like I said, on this slide, each of these changes is reduced to a line, but at the end of the slide deck, I'll provide you with full program instructions and the links to those so you can look into those if you're interested. FPSA also created a new optional funding for prevention services, prevention service program, which I will talk about more in depth today. It also created new optional funding for a Kinship Navigator program. Like I said, in the next few slides, I'll be talking specifically about the prevention services program, but I wanted to make a point to say that the Kinship Navigation program creates an opportunity for evidence building. In part 2 of this webinar series, planned for this Thursday, we'll address how states have approached the requirements for the kinship navigation and prevention plan. So both of these components that are on this slide. And I would encourage you to attend to think more about kinship navigation work in particular and how that's being implemented in the states and opportunities for evaluation and building the knowledge base. So I think I just went through key components of Family First legislation overall to give you a framework. And now I'll talk specifically about the Title IV Prevention Service Program. So the Title IV Prevention Services 5-year plan provides 4E funding for certain time-limited, 1-year prevention services for mental health and substance abuse prevention and treatment services and in-home parent skill-based programs. This provides an opportunity for building evidence and collaboration for public and private sector to work in strong collaboration in order to improve outcomes for children and families. There are strong implications for collaboration among child welfare agencies, the legal and judicial system, the Medicaid and mental health systems, public health, housing, substance abuse treatment programs, to name a few. Focusing on the Child Welfare Agency alone is not sufficient to provide the range of prevention services now available to children and families under FIPSA. Creating a range of prevention services, particularly in rural areas and states, will require bringing both public and private sector prevention organizations into the planning and implementation processes for these 5-year plans. And specific to you all, the Title IV Prevention Services Program, which includes requirements that services be evidence-based and requires evaluation of interventions to states who wish to have and use more robust evidence. So who can receive services? Services under the prevention plans are available to candidates of foster care. And this is defined in statute for the purposes of the Title IV for child welfare Title IV agencies. But just because I know there's a range of knowledge about child welfare among everybody on this call, just to say that a candidate of foster care is defined by statute as a child identified in a prevention plan as being at imminent risk of entering foster care, but who can remain safely in their home or in a kinship placement as long as services or programs that are necessary to prevent entry into of the child into foster care are provided. Services must be evidence-based, specifically designated by the Title IV Prevention Clearinghouse that you'll hear from later in this presentation. Service types include mental health and substance abuse prevention treatment services provided by a qualified clinician, and in-home parent skill-based programs that include parenting skills training, parent education, and individual and family counseling. So on this next slide, for states and tribes that elect to provide Title IV prevention service programs must submit a prevention services and program 5-year plan as part of their Title IV plan. And this is in my office. This is the work we do, is reviewing these 5-year plans. The plan must describe a variety of things, including the target population, how outcomes are expected to improve, consultation with other agencies, an evaluation strategy, the specific practices the state or tribes plan to use. Areas of interest to you all are what opportunities are the areas for knowledge building. So in the next few slides, I'll focus on 3 areas: CQI requirements, evaluation requirements, and independent systematic reviews. I think I'm still good on time here. So I feel like I'm just flying through these, but I wanted to just make a point about CQI and the Prevention Services Plan. This area of continuous monitoring, which is commonly known as CQI, many Title IV agencies will be implementing new programs and services for the first time through their prevention program plans. Hence, an important component of developing a prevention plan includes information as to how the proposed evidence-based program and services will be implemented into the Title IV agency's existing CQI structure. There are 3 main categories. First, monitoring and implementing to ensure that the information is provided in the plan regarding implementation strategy for each proposed program or service with consideration to the implementation needs of that specific community. A key part of this is fidelity monitoring. States must address in the plan how the Title IV agency will ensure fidelity to the practice model for each program or service. The next area is specific to outcomes. How the agency will determine how CQI outcomes will be achieved. For example, outcomes such as safety, permanency, and well-being, as well as individual and programmatic level outcomes as appropriate. The agency must describe mechanisms for gathering, organizing, and tracking information and results over time. And the final area is the development of a continuous feedback loop. Just to say, states must provide information in the plan as to how the agency will use the information learned during the CQI in driving change with the organization in order to improve the outcomes for children and families. And next, I think most notably, the opportunity to build evidence, the evidence base through prevention plans is through the evaluation requirement. This slide includes what we're looking for in terms of the prevention plans from the Child Welfare Agency. States are required to include a well-designed and rigorous evaluation in their prevention plan. The evaluation strategy must be comprehensive, and it must include multiple programs and services. It must include an evaluation strategy for each program or service included in the prevention plan, and it needs to be rigorous and well-designed. So what do we mean by that? And that's under these evaluation components, I just tried to put a couple key areas. States are able to use the Title IV funding for the evaluation. This is an opportunity for states to develop strong evaluations that will be able to be reviewed by the Clearinghouse potentially. This is particularly true for promising and supported programs to move them to be well-supported programs. To note, ACF has many resources for states to use as they build their evaluation plans, and I have some of those links at the end of this, at the end of my remarks. Now we'll just move quickly to discussing the independent systematic review process. I just wanted to make a note that states are allowed to do an independent systematic review, which is a time-limited opportunity for states to claim transitional payments for services and costs associated with those services of programs until the Prevention Services Clearinghouse can review and rate a program or service. The Prevention Service Clearinghouse makes a final determination about whether a program or service is assigned the rating of promising, supported, or well-supported. But a state can conduct their own independent systematic review of programs and services that have not been rated by the Clearinghouse and submit that for claiming under their prevention plan. Now, beginning in October, so I think that the clearing, before I move it over to the Clearinghouse and pass it over to Chris Fortunato, I just wanted to quickly mention that beginning in October 1st, 2019, states with an approved prevention plan were able to start claiming for programs and services under the prevention program, just to give you an idea of timing. So at this point, these are our approved and submitted plans. At this point, 13 states and 2 tribal jurisdictions have submitted plans. Of those, 6 have been approved, and there are others in the review process. I'd like to just mention we do on our website for the Children's Bureau, we have a page specifically about the prevention plans, which includes a list of all the states who have submitted plans, approved plans, and it also includes up-to-date information about who submitted independent systematic reviews as well. So with that, I think just to make the point that I think there are very substantial opportunities for knowledge building through FPSA and the prevention plans. It's really a lever to build knowledge within the child welfare system and larger communities. Within the prevention plan, there are requirements that really help move this forward, specifically with CQI and the evaluation. With this, these are just my 2 pages on resources that I would urge you to look back on. And with that, I'd like to pass it over to Chris Fortunato.
Thank you, Dory. Thank you all for joining us today. I have the pleasure of introducing you to our presentation on the Title IV Prevention Services Clearinghouse. As Lauren mentioned at the beginning of today's session, I am Christine Fortunato, the Child Welfare Research Team Lead at the Office of Planning, Research, and Evaluation within ACF. I will be co-presenting with Sandra Wilson, the Project Director for the Prevention Services Clearinghouse from APT Associates. I'm going to give you a brief overview of this presentation, and then I get to hand it over to Sandra, which is great for me. So in the presentation today, we will describe the standards and procedures that the Prevention Services Clearinghouse uses to carry out the systematic evidence review. The entire review process is outlined in detail in the Handbook of Standards and Procedures, which is available on the Prevention Services Clearinghouse website. So we'll also give you a brief tour of the website later on in today's presentation. So at the end of the presentation, we're also going to have a few minutes for questions and answers. If we don't make it through all of your questions today, don't worry. You'll likely be able to find answers to many of your questions on the FAQ section of the Clearinghouse website. Before we discuss the review process, I want to give you a brief overview of the background and purpose of the Prevention Services Clearinghouse. ACF established the Prevention Services Clearinghouse to perform systematic reviews of the research and evaluation on the programs and services intended to provide enhanced support to children and families and prevent foster care placement. As Dory mentioned, the Prevention Services Clearinghouse was developed in accordance with the Family First Prevention Services Act of 2018, and the Clearinghouse reviews and rates mental health prevention and treatment services, substance abuse prevention and treatment services, in-home parent skill-based programs, as well as kinship navigator programs. The Handbook of Standards and Procedures details the systematic review process we use to identify and rate studies, and ultimately provide the ratings of programs and services as well-supported, supported, promising, or does not currently meet criteria. This handbook was created in collaboration with many stakeholders and experts, including content experts and research methodologists, as well as federal staff. So now it is my pleasure to turn it over to Sandra, who will talk about the review process.
Thanks. And thanks everybody for joining us today. It's exciting that we have such a turnout. So I'm going to talk about our systematic review process, and this infographic provides a high-level overview of the 6 steps that we follow to identify and rate programs and services for the Clearinghouse. If you'd like to come back to this infographic, you can find it in the review process section on the website. It's also in the slides as well. All of the programs and services that we review go through the process. Each step in the process is carefully documented by our staff. We use the systematic review process in order to remain objective about the programs and services we review and be transparent about the process. So the first step in our process is to identify the programs and services that we're going to review. We use several sources for this to ensure that the programs and services we review are relevant to our users, including public calls for nominations and recommendations from our federal partners like the Children's Bureau. Only some of the programs identified will be selected and prioritized for review. And in that process, particular consideration is given to programs that are recommended by state or local government administrators, those rated clearinghouses, programs recommended by our federal partners, and programs evaluated, the supportive grant programs supported by the Bureau. Sorry, I've lost my place. Okay, so the prevention services prioritizes programs in a way that ensures representation across the 4 program or service areas. And those are, again, mental health prevention and treatment services, substance abuse prevention services, in-home and skill-based programs, and kinship navigator services. To be eligible for review, programs must be clearly defined and replicable, which means they need to have a book or a manual or writings available that explain how to administer or deliver the practice. We prioritize review also based on target outcomes, which include child safety, child permanency, child well-being, and adult well-being. And then for kinship navigator programs only, we also have 3 additional outcomes, including access to services, referral to services, and satisfaction programs. Our other prioritization criteria include that programs are in use or active, that there are implementation and fidelity supports available, and again, representation across our 4 service areas. So once a program or service is identified and prioritized for review, the next step is to identify the steps that will be used to determine the program or service rating. Studies are located from a wide range of sources, including publicly available evidence reviews and registries. We also conduct comprehensive literature searches. And then the staff clearinghouse organize and document all of the search results, which are then assigned to our team of screeners for eligibility screening. And step then is, of course, eligibility screening. So for a study to be eligible for review, it must assess program impact on or more of the target outcomes, again, child safety and permanency, and child and adult well-being. In addition, to be eligible for review, studies must also meet the following criteria. They need to be published or prepared after 1990. Studies must be publicly available and published in peer-reviewed journals or in research and evaluation reports. Studies must be available in English. And then 4th, studies must use a randomized or quasi-experimental group design with at least 1 intervention condition and at least 1 comparison condition. Comparison groups must be no or minimal intervention groups or treatment as usual groups. The 5th step in the evidence review process is where we evaluate the credibility of the available evidence on the selected programs and services. Every eligible prioritized study is reviewed by 2 trained reviewers using our design and execution standards, which are described in detail in the handbook. We also assess all studies for potential risk of harm. So our design and execution standards focus on the internal or causal validity of the studies. That is, whether the study design and the procedures used by the study author, that is how the authors execute the design, whether that produces credible evidence about the causal impact of the intervention on the outcome. When we apply the design and execution standards to the eligible research studies that we review, the result is one of 3 ratings. First, studies with high supportive causal evidence rating meet our highest standards for credible evidence. Studies with a moderate supportive causal evidence rating are still rigorous, high-quality studies that produce credible evidence. They don't receive the highest rating because not all threats to the internal validity of the study can be ruled out. The third rating is for the support of credible evidence. These studies do not provide credible evidence and are not used to determine the program and service rating, well supported, supported, and promising. Only randomized studies with low attrition can achieve the highest rating because these designs produce the most credible evidence. So most of our design and execution standards are operationalized differently for each type of design, but some standards are applied in the same way to both randomized controlled trials and quasi-experimental designs. These include looking for confounding factors that might make it difficult to attribute an observed intervention effect to the intervention. Our reviewers evaluate whether missing data were addressed using methods that limit the potential bias. Reviewers also assess whether outcome measures are reliable, face valid, and whether they are administered systematically and consistently. Finally, the reviewers evaluate the statistical models used to estimate the impacts of the interventions to ensure that the impacts reported on the Clearinghouse website are valid estimates of the intervention's impact. Now, for randomized studies that meet the general requirements I just described, reviewers will follow a flow chart like this one to determine the study rating. Evaluate the integrity of the randomization process, the overall and attrition by baseline equivalence, pretest measures of the outcome, and in some cases, other key covariates, and whether how study authors use statistical controls for baseline differences. Reviewers use a flowchart like this one to evaluate quasi-experimental designs. You can see that these designs are not eligible to receive a high rating. Studies that use quasi-experimental designs can only be considered for moderate or low. So for quasi-experiments as well as randomized designs with high attrition, our reviewers assess baseline equivalence on pretest measures of the outcome, in some cases other important covariates, and whether and how study authors employ statistical controls for baseline differences. So now that I've gone over the design and execution standards at a very general level to give you a sense of what aspects of study quality we assess, the handbook provides much more detailed description of each standard and how it is assessed by our reviewers. I'm going to turn it over now back to Christine to talk about how we determine the program ratings that roll up from our reviews of the studies.
Thanks, Sandra. So the final step in the Prevention Services Clearinghouse review process involves assigning the program and service ratings, as Sandra just said. Once all the eligible studies that support the evidence base for the programs or services are assessed, the program and services receives a rating, and there are 4 possible ratings, as we mentioned previously. In accordance with FIPSA, the first possible rating is well supported. So to achieve this rating, programs must have at least 2 studies with non-overlapping samples where both studies were delivered in usual care settings, and both studies had high or moderate ratings on those design and execution standards that were just discussed. A usual care or practice setting is defined as an existing service agency or provider that delivers mental health and substance use prevention or treatment services, in-home parent skill-based programs, and or the Kinship Navigator programs as part of its typical operations. Now, there must be favorable effects found for at least one target outcome on each of the 2 studies, where a favorable effect is defined as a statistically significant finding on an eligible outcome that favors the intervention group. And at least one of the studies must show that there's a sustained favorable effect lasting at least 12 months beyond the end of treatment. And the end of treatment is defined as the stated end of treatment by the study or the program documentation. So if a clear end of treatment is not defined, if treatment extends indefinitely or varies across participants, or if the services are staggered, the clearinghouse selects a time point that corresponds to when the majority of a clearly defined set of services were stated to have been delivered. So in accordance with FIPSA, a program or service can't be rated as well supported if there is sufficient evidence of risk of harm, such that the overall weight of the evidence does not support the benefits of the programs or services. And to assess this, the Prevention Services Clearinghouse looks for the presence of statistically significant unfavorable effects on target or non-target outcomes. Okay, so for our second rating, possible rating, that's supported. So in accordance with FIPSA, those programs or services that receive a supported designation will have at least one study that is high or moderate on design and execution, and that is also carried out in a usual care setting where sustained favorable effects are demonstrated for at least 6 months beyond the end of treatment. Again, a program or service cannot be rated as supported if there is sufficient evidence of risk of harm. The third possible rating is promising. So in accordance to FIPSA, those programs or services that receive a promising designation will have at least one study that has a high or moderate rating on design and execution and has a favorable effect on at least one target outcome. One more time, again, a program or service cannot be rated as promising if there is evidence of risk of harm. The fourth and final rating is does not currently meet criteria. In some instances, there may be no studies of the program or service that receive moderate or high design and execution ratings. And in other instances, there may be studies with moderate or high design and execution ratings, but they do not exhibit any statistically significant effects on a target outcome. These programs will be rated as does not currently meet criteria. Further, if there is sufficient evidence of risk of harm, the program may be deemed does not currently meet criteria by the Prevention Services Clearinghouse. Now for the fun part, we'd like to walk you through some of the information that's available on our website. As you can see on this snapshot of the homepage, website visitors can learn more about the Clearinghouse, including FAQs on the About page, navigate through the specific programs that have been rated on the Find a Program or Service page, learn about the Clearinghouse's standards and procedures on the Review Process page, and access relevant resources on the Resource page. You can also sign up for the email updates about the Clearinghouse. Please feel free to do so. If you click on any program or service on the Find a Program Service page, you'll be taken to the information about that particular program. And on this slide is the Parents as Teachers program page. And as you see, there is the program description followed by a series of accordion bars, and they provide additional detail about the program or service. This includes information about the target population, program or service delivery and implementation information, the extent of the evidence, a summary of the findings, information about the individual study findings, and a list of all the studies reviewed. Okay, Sandra, I'm going to turn this back to you for our closing remarks.
Excellent, thank you. So you guys can see on the screen our website address, and I just wanted to thank you for your time and attention today. And please sign up for our email address to get updates when new programs are released, among other things. And I think we are going to transition to a little question and answer right now. And so I'm going to turn it over to who's ever in charge of moderating that.
Thank you. That would be me. This is Meg again. We do have a couple questions in the chat, and I would encourage anybody, if you have any questions or comments for our speakers, please go ahead and utilize that question and answer chat box, and we'll try to get to all of them. So I'm going to start off for our speakers. We have a question here. Is there specific funding for evaluation included within the Family First Prevention Services Act?
Hi, this is Dory. Meg, I can take that question. So there's not specific funding, somebody else trying to speak, for the evaluation in FPSA, but like I mentioned in my remarks, for states that include their evaluation in their prevention plan, they can use the Title IV funding to carry out that evaluation.
Thanks, Dory. And we'll move on, unless there's anybody else had a reply. I'll just give a second. All right, so we'll move on to our next question here. The question states, we are a CSEC group home for minor women rescued out of HT for long-term rehabilitation and safe harbor. How will this affect us in any way?
This is Dorian. I'll take that on. So that's wonderful. You're a long-term rehabilitation and safe harbor. How will this affect us? So I think what you're asking is how will FPSA affect you, if at all? And so I don't know. I think I would need to talk to you specifically about any provisions that you're interested in or that you're curious about. And then I would be happy to direct you to the correct person in the Children's Bureau. When I talked specifically about the prevention plans, those prevention plans are optional for Title IV agencies. I want to make that really clear. And so I think that there might be opportunities for you to really get connected to what's happening at your state level. But if you have specific questions about more broadly Family First, I would encourage you to email me and I can direct you to the right person. So I hope that helps, and let me know if there's anything more specific that you're wondering about.
Thanks, Dory. We did have a question about forwarding the registration link for Thursday. I don't think there's a way I can drop it here, but you can, it should be available on aphsa.org under Events tab, and you can also feel free to email me. It's mdygert@aphsa.org, and I can forward you that link as well. So we're going to move on here. Our next question. When the 12-month count began, when identified as a candidate, or when the start of the prevention services? And I can rephrase that. Does the 12-month count begin when identified as a candidate or when the prevention services start?
So this is Dory, and that's I just want to point out that, I had notes, and in my notes I skipped one point, which is exactly this point, so that's a really sharp catch. But allowable services, like I said, are limited to 12-month period that begins on the date that the child is identified in a prevention plan as either a candidate for foster care or a pregnant and parenting youth in need of those services and programs. So I hope that answers your question. So that begins on the date the child is identified in the prevention plan as one of those identified populations.
Thank you. And we did have an ask to put the supported slide back up, so you guys will see that the supported slide is back up there. And there's also a question of how we can get copies of today's slide presentation. You should see up in the top corner in the webinar a handout function. You should be able to download the slides from that. If you have any problems with that, please reach out to me and I can get you those slides as well. So we're going to move on here. If you reviewed and did not receive a well-supported rating, what is the process for resubmitting for a review? And I think we'll throw that over to our person from APT to answer that one.
Hi. I would encourage you to visit our website, and you can find our help desk email there on the website, and you can resubmit there. Does not mean that we will re-review, but you are welcome to do that, and do the handbook too. Any information that you think would be helpful to us, you can also include, or any new research that has come out in this review.
Yeah, and I'll add to that, Sandra. This is Chris. On the FAQ page, we do have, because this is a frequently asked question, if a program or service can be re-reviewed. And if you look there, there's the answer and the section of the handbook for the process for requesting a re-review. And the Clearinghouse staff keep track of those dates that the programs and services are reviewed, and then they periodically assess the extent of the new evidence available. But yes, please check out that FAQ page. Thanks so much.
Thank you. And our next question here, are we tracking which independent systematic reviews have been approved and for which reasons? And Sandra, I don't know if you want to start that question.
I think that is a question for Dory, because the independent systematic reviews are reviewed by the Children's Bureau rather than by our team at the Prevention Services Clearinghouse, just to make it complicated.
That's right. Just to be clear, the independent systematic reviews are submitted as part of a prevention plan, and those are reviewed by a team at the Children's Bureau. And the question, are we tracking? So the Children's Bureau, what we have on our website is essentially those independent systematic reviews that have been reviewed and approved as part of prevention plans, the Children's Bureau. So that's what information is publicly available on our website. And I can, I have a link to that specific page in one of the links at the end of my remarks. What it doesn't include are the reasons, but what we have, I have to remember the PI, but the process for the transitional payments PI, the process for reviewing the systematic reviews is really like step-by-step laid out in the transitional payments PI for those independent systematic reviews. And essentially we're reviewing like exactly according to that criteria. I have a link to that as well. Oh, thank you for putting that page back up. And yeah.
Thank
I'll
you.
just leave it there unless there's more questions on that.
I think we do have a couple more questions on evaluations. Are there any limits or requirements on the funding for evaluation? For example, hiring FTE contract out, discretionary funding for incentives, etc.
I think it was, you were talking about evaluations in the Title IV prevention plans. I'm looking for this question in the chat, but that's my understanding. So if the question is specifically about the evaluations in the prevention plans, I would really urge you to look at the PI 1809. That's kind of in the middle of the page here, to look at the program requirements. But in terms of the funding, I mean, I think that all states are really designing their evaluations in different ways, and the way that they're approaching those plans are varied. I think, sorry, I don't see the question. Oh, no, I do. Are there any limits on the requirements on funding? Hiring or discretion? But I'm not aware of any limits that you might be referring to, but I think I might not be understanding your question. So if you want to email me separately, and then we can check in more about that so I can address your question.
Okay, we did have a follow-up to the systematic review question. The question reads, some Family First approved interventions, actually, hold on, sorry, wrong one. He submitted two questions, sorry. To follow up on the independent systematic review question, our agency is interested in learning which interventions were submitted but not approved. So we have a sense of which interventions may or not be worth submitting for consideration under independent systematic review. Dorian, I think you led that. I don't know if that helps with some context there.
Right, we don't, that information is not available on our website, but I will say, you know, there's not a large group of programs that have been submitted through the independent systematic reviews and not approved. That would be information that the states would be able to provide about their specific plans.
All right, we are butting up right against the top of the hour here, so I'm going to pose one final question to the group. So this one's specifically for the Children's Bureau. While a continuous quality improvement process is a necessary component of the state plan, what support, guidance, or TA does TA offer or plan to offer states on how to make the data they use to continuously evaluate outcomes and revise services based on this learning?
That's a great question. I think this is an incredibly important area. At the Children's Bureau, we work very closely with the Center for States that works with states, and there's a lot of work that goes into CQI in their child welfare systems overall. But I think that what you're getting at, your question is right. This is an area that is really ripe for a lot of learning about the programs as they're being implemented. They're being implemented with fidelity, and then what learnings are really coming from that. So we have really a lot of robust TA providers. But really, I think the challenge is, and the opportunity is really bringing the services that are in the prevention services plan, those continuous monitoring efforts, and really being able to embed those in the current CQI processes within the child welfare agency that already exists. So there is a lot of work there. I hope I answered that question. But thank you for that question. And if there's nothing else, then I'll give it back to you, Meg.
Thank you, and I'm going to hand it off to Lauren to do some closing remarks. I did just want to re-say the name for anybody interested in Part 2. That's available at aphsa.org under the Events tab. And Lauren, I'll hand it over to you.
Thank you so much, Meg. So real quick, huge thanks to Meg and APHSA and PCG Consulting for helping NARS put this on, and our speakers, Dory, Chris, and Sandra. As you see on this last slide, we do have the link here as well to register for Thursday. We'll dive a little bit deeper into 2 states that have approved plans, Arkansas and Ohio. And then if you're interested in learning more about NARS, please, you can find us at nawrs.org or on Twitter. We have more conversations coming this summer, in particular a conversation in August with SNAP directors in this time of COVID, as well as machine learning and human services, and cross-system collaboration to serve justice-involved clients. So a huge thank you everyone for joining. I know we didn't get to all the questions, but we really appreciate your engagement today, and I hope to see you on the call or hear you on the call on Thursday. Thank you, Meg.